Hello, my name is Alvin J. Estano from Group 2 of 3DVM-B, and in today's video, we will be going to discuss the drugs acting on skin and mucous membranes. First class of drugs under skin and mucous membranes are the protectives and adsorbents. Here we have dusting powders and mechanical protectives. So, what are these adsorbents and protectives? These are finely powdered, inert, and soluble solids capable of inactivating the irritants by binding to them. They exert physical protection to skin or mucous membranes. Here are some examples of adsorbents and protectives. We have olive oil, kaolin, and calcium carbonate. So, what are the difference between the two? Adsorbents act by binding gases, toxins, and some organisms such as bacteria to prevent exposure to the damaged skin surface, while protectives function by providing an occlusive layer of protection from the external environment or by providing mechanical support to the affected area. Protectives and adsorbents can further be divided into two subclasses: dusting powders and mechanical protectives. Here we have dusting powders. These are generally inert and innocuous substances like starch, calcium carbonate, talc, titanium dioxide, zinc oxide, and boric acid. We also have here mechanical protectives. These provide an occlusive film that protects the underlying skin from irritants present in external environment. Examples are kaolin, lanolin, anhydrous lanolin, mineral oil, olive oil, peanut oil, petroleum, and zinc stearate. Next class of drug under skin and mucous membranes are demulcents. Demulcents are generally high molecular weight compounds that are water-soluble and functions by alleviating irritations. Examples are glycerine, propylene glycol, solutions of gum acacia, and gum tragacanth. These are inert substances which soothe and relieve irritation, primarily by involving the inflamed or injured mucous membranes. They form a protective layer over the irritated surfaces. Here we have some examples of demulcents. We have gum tragacanth, glycerine, and propylene glycol. Next class of drugs are emollients. These are bland fatty materials often used to soften or moisten the skin. When used topically, emollients soften skin by decreasing transepidermal water loss or transpiration and increasing the hydration of the stratum corneum. These are primarily useful when treating skin conditions resulting from water-soluble irritants and airborne bacteria because of their ability to act as a protectant, sequestering the damaged skin away from these noxious stimuli. One recent example of this emollient is dimethicone. This is a silicone-based polymer that is frequently used as a skin protectant. This medication is used as a moisturizer to treat or prevent dry, rough, scaly, itchy skin and minor skin irritations. Therefore, this is a useful group of compounds for treating dermatologic conditions involving dry, crusty, or flaky lesions of the epidermis. Other examples of emollients include vegetable oils like olive oil, cottonseed oil, corn oil, almond oil, peanut oil, persic oil, and cocoa butter. Animal fats like lanolin or wool fat with water added, anhydrous wool fat, no water added, lard, and whale oil. Hydrocarbons like paraffin, petroleum, white petroleum or Vaseline, mineral oil, white or yellow waxes or beeswax, and spermaceti. Another class of drugs are these astringents. Astringents are agents that precipitate protein, toughen the skin, promote healing, and dry the skin when applied topically. When used to coagulate blood, astringents are said to be styptic and elicit a mildly uncomfortable sensation when applied to small open wounds. Most of the chemicals in this group are inorganic salts of aluminum, zinc, potassium, and silver, and include anhydrous aluminum chloride, calamine, zinc oxide, zirconium chlorhydrate, and tannic acid. They are mainly germicidal agents that have also astringent activity. Other astringents are of vegetable origin, most of these preparations owing to their activity to tannic acid. Astringents in the vegetable derivative group include gallic acid, kino, gramineria, and rubus or blackberry. Next class of drugs are gastrointestinal mucosal protectants. These are agents which protect the intestinal mucosa against irritation by forming a protective layer, neutralizing the irritants, or absorbing the irritants. Here are some examples of GI mucosal protectants: kaolin, activated charcoal, bismuth carbonate, and etc. Next, we have the counterirritants. These are agents used to produce hyperemia in an attempt to relieve pain and promote healing of tissues beneath the skin after application over the surface. A counterirritant will cause an overriding acute inflammation with a great increase in vascularity and consequently an increased blood supply to the area. It is hoped that when this acute inflammation subsides, the cause and some of the results of the chronic inflammation will also have been removed. 3 stages of counterirritations are distinguishable. We have first the rubefacient action, when the counterirritant applied causes only mild irritation and a small increase in congestion. Next is the vesication. This damages the capillary system and results in serous exudates collecting in the superficial skin layers to form blisters. Lastly, we have pustulation. Deep layers of the skin are damaged and the blisters become filled, not with serous exudates, but with the products of cellular destructions. Let me discuss the 3 stages of counterirritations one by one. First, we have the rubefacient action. Literally translated, the term means to make red. Rubefacients often have pain-relieving or anodyne properties. Examples are iodine, camphor, methyl salicylate, turpentine, and ammonia. Vesication. It occurs when the irritation is severe. This is the origin of the common name for vesicant dressing, blisters. Under vesication, we have 2 different examples of counterirritants. First, we have the cantharides. These are obtained from the dried beetles, Spanish fly, and contain cantharidin. Ointments containing 0.01 to 0.16% of cantharidin are used to cause blisters. Blistering is used to treat tendon injury in horses, being a mild and more acceptable treatment than firing. Mercuric iodide or red iodide of mercury. It is a commonly used blister when made in a base of lard or soft paraffin. It is used in concentrations of 2 to 10% and following rubbing of this ointment on skin for 5 to 10 minutes. Blistering follows after a few hours. Whenever a blistering agent is used, care must be taken to protect surrounding tissue by application of zinc oxide ointment. Third and last, we have pustulation. When skin is damaged, the ability of regeneration is lost and scar tissue is formed, which, when it contracts, may limit the action of joints or tendons and at best cause permanent blemishes. Examples of pustulants are 25% strong ointment of red iodide of mercury and 12% cantharidin ointment. Last class of drugs under skin and mucous membranes are keratolytics, keratoplastics, and antiseborrheics. Keratolytics function by loosening keratin, which facilitates the desquamation of stratum corneum. On the other hand, keratoplastics attempt to normalize keratinization by slowing basal cell proliferation through inhibition of DNA synthesis. Antiseborrheics attempt to modulate sebum production in the skin. Many of the keratolytics are also keratoplastics and are antiseborrheics. Therefore, these functions are discussed together. Here are some examples of keratolytics, keratoplastics, and antiseborrheics. First, we have salicylic acid or 2-hydrobenzoic acid. It is used topically as keratolytic, keratoplastic, and antiseborrheic agent and has some mild antibacterial and antifungal actions. Salicylic acid, 2 to 10%, causes the dead or dying cells of the stratum corneum to hydrate, swell, and soften, thereby hastening their desquamation and solubilizes the intercellular lipid layer, releasing the cells of the stratum corneum from each other. Salicylic acid ointment is used in hyperkeratosis, a solution containing 40% antimony trichloride plus 5% salicylic acid or 3 to 5% salicylic acid and alcohol. A solution of 10 to 20% salicylic acid and alcohol is used for dissolving corns. Next example is benzoyl peroxide. It is metabolized to benzoic acid by the viable epidermal cells during penetration. Keratolytic, anti-seborrheic, strong oxidizer, free radical generator, and so have some bactericidal actions. Last example is resorcinol or M-dihydrobenzene. These are keratolytic agents having some bactericidal and fungicidal properties. They precipitate protein like urea and they promote hydration of keratin, resulting in its keratolytic function.
Good day, my name is James Luke Aparece from 3DVM-B and I am here to be continuing to report on the drugs that act on the skin and mucous membrane, and in particular we're going to be discussing caustics and ascarotics firstly. So what are caustics and ascarotics? Caustics are also known as corrosives, and these are agents that destroy tissue after one or more applications. Ascarotics, also known as cauterizers, are corrosive and will also precipitate proteins leading to scab formation and eventually permanent scar formation. Caustics have been used to induce deformation of the stratum corneum, which is the most superficial or the uppermost layer of the skin, and thus they have been considered to be keratolytic. And they have been used to treat warts, keratosis, and other hyperplastic skin diseases. Ascarotics have also been used to heal cutaneous ulcers and wounds. The examples of caustics and ascarotics are silver nitrate, phenol, and antimony trichloride, which is frequently used for wart removal, glacial acetic acid, which is occasionally used for wart removal, and antimony trichloride, which is an ingredient that is used for debudding preparations for calves. It is usually combined with salicylic acid to soften the keratin layers of the skin in concentrations of about 28% chloride, particularly antimony trichloride with 5 to 7% acid. So, antimony trichloride is typically used for debudding, which is the act of removing the horn buds of the calves in order to inhibit its growth further on its development. And this is usually done rather early on, particularly 48 hours is the most effective. So in terms of debudding, we also need to consider some points in order for debudding to be properly performed. So the first point is that caustic debudding preparation does not adhere to wet or greasy surfaces. As such, it is therefore necessary to clip, clean, and defat the horn bud area with ether or chloroform before applying the caustic preparation. Normal skin surrounding the skin bud should be protected by the application of a protective greasy ointment such as zinc oxide and ointment, and this is because caustic preparations are keratolytic, which means they will degrade and erode through the stratum corneum or the superficial skin layer. Debudding to achieve the best results should be carried out within 48 hours of birth, and treatment should be thorough. So moving on to skin disinfectants. So skin disinfectants are used for the removal or reduction in bacteria on the skin, and it is a useful part on the treatment of pyoderma. The agents used include those used for skin disinfection prior to surgery, such as povidone, iodine, chlorhexidine, citrinamide, and hexachlorophene, and also specific skin disinfectants, particularly benzoyl peroxide. So, to give emphasis on the benzoyl peroxide, it is a substance that is bactericidal due to its ability to slowly release oxygen, and thus it is quite effective towards anaerobic and microaerobic bacteria. The compound is also keratolytic and anti-seborrheic, which means it has an effect on the skin and is well suited to the treatment of pyodermas. In veterinary medicine, shampoos containing 2% or 5% of benzoyl peroxide is available. So what is the common applications of benzoyl peroxide? It is usually used to treat lip fold pyoderma. And lip pulpoderma is a common cause of bad breath or halitosis in dogs, and this is usually remedied by bathing the lip fold affected with pyoderma with benzoyl peroxide. So this is an image depicting lip fold pyoderma. As you can see, uh, the the layers of the lip as well as some parts of the rostrum has been heavily eroded, and there's also the presence of exudate, which indicates a bacterial infection. And this is usually remedied by washing or bathing the area with benzoyl peroxide. So moving on to antibiotics and antibacterials. Antibiotic therapy is often a necessary part of the treatment of pyoderma. This may be local, topical treatment in case of limited scope, but more commonly, the extent of the lesions requires systemic therapy. The choice of antibiotics for local treatments includes creams containing neomycin, mupirocin, or fusidic acid. For systemic therapy, activity against beta-lactamase producing staphylococci is important. Thus, cephalexin, clavulanate, potentiated amoxicillin, and lincomycin have all been found to be effective. Treatment needs to be prolonged, in the most cases for more than 2 weeks, and relapse is rather common. So, another drug that acts on the skin and mucous membrane are the corticosteroids. The corticosteroids have been used extensively to treat skin diseases in animals, and this may be applied topically, and the main indication is in the treatment of otitis or the inflammation of the ear, but it is important that a suitable antibiotic is also included. For example of corticosteroids include hydrocortisone, prednisolone, prednisone, methylprednisolone, flumethasone, dexamethasone, betamethasone, and more. Glucocorticoids are also indicated for the treatment of many allergic dermatoses, notably allergies such as the flea bite dermatitis or flea allergic dermatitis or FAD, food allergies, contact dermatitis, autoimmune diseases, pyotraumatic dermatitis or hot spots, and more. Glucocorticoids are inflammatory modulators, which means that they work better in combination with antibiotics or antifungal agents. Glucocorticoids have functions other than controlling inflammation and inducing immunosuppression. Many skin diseases have neutrophil infiltration in the dermis and/or epidermis, and as such, glucocorticoids have a marked ability to stabilize lysosomal membranes within neutrophils, thereby inhibiting the release of enzymes that result in dermatitis. Since glucocorticoids have an effect on other body systems, it is important that we need to consider certain guidelines in order for its safe application. So first is we need to be sure of the diagnosis, and glucocorticoids are generally used to relieve the symptoms of pruritus. It is important to make effort to determine it. Not performing the routine measures to determine the underlying cause of pruritus may lead to serious systemic side effects. The second is to use the least amount of steroid to achieve the clinical effect, as well as using the least potent steroid to achieve the clinical effect. This is to mitigate the amount of side effects that the animal will suffer when applied with the steroid, and choose the route of steroid administration according to the type and severity of the lesion being treated. If used with suitable precautions, corticosteroids remain very valuable in the treatment of otherwise intractable or unmanageable skin diseases. So moving on, we are going to be discussing the classes of mediated application. So the first class of mediated application is ointment, and ointment is defined to be a semi-solid preparation that usually, but not always, contains drugs used to treat dermatologic diseases. So this is the image shows an example of ointment used in veterinary medicine. It is mupirocin cream or interbrand cream, and it is usually used in dermatologic applications. The second is poultice or cataplasma, and it is defined to be a soft, moist mass of materials applied locally to an affected area and was historically composed of roots, herbs, seeds, and even mud in a gruel-like paste. The poultice was intended to be a topical wound treatment, serving as a counterirritant and absorptive/adsorptive sink. Poultices are used externally as a hot or cold local application with the aim of reducing inflammation and relieving pain, but poultices are rarely used in veterinary medicine today. So this is an example of a poultice or cataplasma. This is usually accompanied with a form of dressing in order to hold the poultice on the injury and to protect the uh, poultice applied injury from the elements. The pastes are absorptive powders that are placed in a gelatinous base, and it's usually petrolatum or hydrophilic petrolatum. Pastes have been used to adhere to the skin and thereby act as a sponge to absorb exudates and moisture, and also as a barrier to protect the skin from the external environment. Pastes are easily removed from the skin and can be used on moist lesions of the skin. So unlike caustics or escharotics, pastes can be applied to moist lesions without cleaning or drying the wound. So this is an example of a paste. It is an oral paste called Caniberm. Powders are a class of vehicles that is used for the delivery of topical drugs to the skin. Powders are commonly used in veterinary medicine to deliver pesticides such as carbaryl and permethrin for the control of external parasites, particularly fleas, and in large animal veterinary dermatology to deliver antibiotics such as nitrofurazone to wounds. So this is an example of a powder. This is ectoform powder, and it's used um, for the treatment of domestic farm animals. So dressings are external applications of some compounds, such as petrolatum, ointments, poultices, etc., on an application device such as wrap or sterile gauze, and are placed over wound sites to protect the skin lesion from external environmental trauma. Dressings may also contain antimicrobial agents such as nitrofurazone. So this is an example of a dressing. As you can see, the white cloth-like cloth-like material is the dressing, and it is used to protect the wound and to hold the substances that have been applied to the wound from falling off and to protect it from the external elements. Plasters are similar to dressings, however they differ in which that plasters are attached to the skin via some adhesive material. So in layman's terms, plasters are typically the band-aids, and they protect skin lesions from external environment and provide an occlusive environment. Plasters have limited use in veterinary medicine today, and this is an example of a plaster. It is quite similar to the band-aid we are all familiar with, and in contrast to dressings, plasters typically have adhesive materials added in order to hold the plaster onto the affected area. So suspensions is a two-phase system composed of a finely divided solid that is dispersed in a liquid that is usually water. Suspensions are not utilized to any great degree in veterinary dermatology today, and they are more commonly used in oral drug preparation schemes. So suspensions are uh, typically tantamount to syrups in oral medicine application, such as deworming applications and antiprotozoals. And the most common type of suspension currently used topically is Captan, which is used to treat some types of superficial fungal infections and which also has some limited bacteriostatic properties. So this is an example of a suspension. This is an amoxicillin plus colistin oral suspension, and it is used for antibacterial treatment in pets. And lastly, lotions are powders dissolved in a liquid, usually water or an alcohol, and lotions, like powders, tend to have a cooling effect, drying, and somewhat mildly antipruritic. Lotions have limited applications in veterinary medicine but are used extensively in human over-the-counter skincare products. And this is an example of lotion you applied for veterinary medicine. And this ends this ends my report on the continuation on the caustics and on the drugs that act on the skin and mucous membrane. And this is the conclusion of our group report. Thank you for watching.